feel a bit jittery and I do get very tired.
And health food fanatic Marie's frustrated she's not been able to help herself.
You know, it's ridiculous. I've got all the information I need. You know, I'm an intelligent woman. I should be able to do it. So I'm determined to do it now.
More than 17 stone between them, these two ladies are battling diet demons at opposite ends of the scale. But before Superskinny takes on Supersize in the feeding clinic, Dr. Christian's sending young Brooke stateside for a taste of what's to come should she not beat the bulge.
I'm Christina White. I'm 48 years old and I'm 32 stone.
Coming up, Supersize Brooke gets scared by what she sees in the States.
I want to live for as long as possible.
Yeah.
On the diet swap, Superskinny Marie gets critical.
I mean, would you always go for white bread? Because I tend to avoid white bread like the plague.
And thanks to Dr. Christian, cheese finally gives Brooke nightmares.
Total saturated fat that you're eating.
Oh, that's horrible.
Weighing in at the feeding clinic this week is Superskinny superfood supporter Marie Sheratt versus Supersize cheese cheerleader Brooke Gamble. These two extreme eaters will face their food fears by swapping diets. But before they do, Dr. Christian's prescribed Brooke a supersized wake-up call in America. To meet 32 stone Christina White.
Life's scary. My kidney doctor told me by the age of 54 I could be dead. And I'm 48 now.
Doctor-to-be Brooke has been sent to Christina in Ohio for a large dose of her future should she not lose weight.
Hi.
Hi.
My name's Brooke.
Hi, Brooke. How are you?
Good, thank you.
And to make sure Brooke takes every drop of her American medicine, Dr. Christian's also en route to surprise her.
Brooke is a medical student. So really the bottom line on this one is she really ought to know better. I hope it's going to be a real eye-opener for Brooke to see the reality of what obesity can do.
Room-bound Christina relies on her daughter Katrina for pretty much everything.
I've been caring for my mom since I was at least 16, so about good 5-6 years. When doctors tell her she needs to lose weight or she's gonna die, that bothers me. It'd just be little old me.
Today, Christina wants Brooke to see the brutality of obesity and take on the duties usually done by her daughter.
I was wondering if you could empty my porta pot.
Yeah, sure. Going to the toilet downstairs in a commode should be something you're doing when you're 70, 80 years old.
But emptying her commode is just the start. Another of her daughter's daily duties is to dress an open wound in her mum's stomach.
You tell me if it hurts, all right?
Oh, it ain't gonna hurt.
Due to her obesity, in 2008, Christina had gallbladder surgery, but there were complications.
They told me that I had gangrenous abdominal area from the gallbladder.
It took 6 months and 7 operations to clear out the infection, but the wound still hasn't healed.
You all right?
Yep, this is what I gotta put up with.
Christina's been given just 6 years to live. Although riddled with diabetes, asthma, kidney and cholesterol problems, nothing's enough to stop her bad habits.
The doctor keeps telling me to lose weight and stop smoking. And it's easier said than done on both.
But that 40-a-day habit doesn't suppress her appetite.
So what's your one weakness for food?
You know, the lunch meats and the cheeses and all the bad stuff for you.
Yeah.
I gotta have some fattening stuff on it for it to taste good, I guess, so.
Is there anything that you used to do that you can't do now because of your weight?
Now I have to depend on a lot of people.
Yeah.
And that's hard.
Without help, Christina can't even leave the house.
When was the last time you came out?
Well, I think it's been about a month.
Really?
Yeah.
But she's leading Brooke to a surprise visitor.
Well, hey, I'm glad I could be of help, you know.
Hello. How are you?
I'm good, thank you.
Christine? I'm Christian. How are you doing?
Hi, I'm doing good. How are you?
How far away do you live? Are you just down the road?
Yes.
Can we walk and sort of talk at the same time?
Yeah.
Yeah? Well, I say walk. You can roll and we'll walk.
There
Is
you
that
go.
all right?
That sounds
Yeah.
better.
Dr. Christian's keen to see just how bad Christina's health problems are, starting with that open wound.
It is pretty hidden by your tummy anyway, isn't
Yes.
it?
That's the problem. It's not getting in a lot of air because my belly hangs over it.
It's pretty shocking,
Yes, it is.
isn't it? They do heal. They gradually sort of seal themselves up.
Right.
Takes a long time. If you're a smoker and you're overweight and you're
Yeah.
diabetic, then you can times that time by tenfold.
Christina ticks all those boxes and more.
How bad is your asthma?
Right now, it's bad because I have a sinus infection going on.
What else makes asthma worse?
Smoking.
And weight. People who are big can have much worse asthma, and if they lose the weight, sometimes find the asthma goes altogether.
Oh, okay.
What's this for? This is for bladder.
Yes.
So you were having continence problems, were
Yes.
you? Okay.
I mean, without those pills, I can get up out of the bed or off this chair and it's coming down.
And again, what's a very common cause of urinary
overweight.
being overweight? Are you getting the message
Yeah.
now? Yeah. I'm getting through.
Yeah.
To see what's causing Christina's obesity, Dr. Christian explores the kitchen.
I tell you what, there is a lot of. My God, here you've got boxes and boxes and boxes of sodas, haven't you?
Yeah.
I mean, this is an absolute disaster for diabetics.
Yeah.
Absolutely, it's the worst possible thing you could be drinking. It's just sugar water, essentially.
I have a problem with the diet taste.
If we assume there's about 150 calories or so per can, actually more, 170 calories, how many cans would you have a day?
Up to 6.
Okay, so that's about 1,000 calories straight away. If you just change that to water or to squash, you would lose weight. That sounds quite easy, doesn't it?
Yeah.
But the only person who can lose the weight is Christina.
You've got to want to change, is what it boils down to.
Yeah,
You've got to want
that's
to
about
do
it.
it. And if you don't want to do it, it's not going to happen, is it?
No, it's not.
Do you want to? That's a no.
Right now,
that
no.
sigh was a no, wasn't it?
Right now, no, because I'm up in my age group and I've got all this wrong with me. I just don't, I don't care anymore.
So what's going to happen?
I'm ready to go anytime. I'm happy with it. I want to be happy and die. Me smoking and drinking my pop, I'm happy.
What do you think of that, Brooke? Are you shocked by that?
Yeah, it kind of upsets me. I want to live for as long as possible.
Yeah.
So I don't want to have health problems that make my mindset happy to go. I want to live as long as possible.
Brooke is a medical student, and I think because of that, she's seen lots of gory pictures of all sorts of funny medical conditions. But I don't think she's ever met a real person in their home with all these sorts of problems. And to have someone sit in front of you and say, I don't want to live anymore, really shocked her.
But has it shocked Brooke enough into changing her ways?
Do you feel now you kind of got the motivation, so when we meet back in London again,
Definitely.
you're going to give it everything?
Yeah.
I can advise, I can kick you up the bum when I need to kick you up
Yeah.
the bum and all the rest of it. But you're the one who buys your food, you're the one that eats your food,
Yeah.
and you're the one that's got to say no to yourself.
I'm definitely at the point now where I need to do it, I know I need to do it, and I want to do it.
Good job too, because back in the UK, the feeding clinic is ready and waiting for Supersize and Superskinny. By swapping diets, Dr. Christian's hoping these two extreme eaters will see the faults in their food habits and find a healthy middle ground. The 2-day diet swap starts here. At 5'9", whole food follower Marie weighs just 7 stone 2 pounds and is 3 stone under her ideal weight. She may think her diet uber healthy, but Marie's food diaries revealed she's lacking vital nutrients like protein and calcium.
Looking at your dietary analysis, you're really eating around 800 calories less than your body requires to maintain your weight.
Oh, right.
That's a huge amount.
Right.
Did you know that?
I didn't.
But definitely quantity is the biggest problem. And I suspect you probably haven't had periods for a while, have you?
No, that's right.
Almost certainly due to your weight. Not having your normal hormonal cycle means your bones will be at real significant risk of osteoporosis, so fractures when you're older and things.
I mean, I was told this once, and I did have a test, and touch wood, I was lucky that the scan was fine at that time.
How long ago was that?
About 15 years ago.
It was a long time ago. Things
Right.
change, and I wouldn't rely on luck when it comes to health.
At 5'6", cheeseaholic Brooke weighs a mighty 24 stone 8 pounds. Only 20 years old and 13 stone overweight, Brooke's risk of heart problems, type 2 diabetes and high blood pressure is excessive.
You are 24 stone 8 at your latest weigh-in, which gives you a BMI of 54.6. If I show you that on a BMI chart, you come out about there, which you can see is significantly into the red. Not just obese, that's morbidly obese.
Yeah.
What is your obsession with cheese?
I just tend to have it in most of the things I eat.
It is the one thing that jumps out of your food diaries. You know, it's very calorie dense. A lot of calories packed into a fairly small volume. That's kind of good news in a way, because it means you can cut out quite a lot of calories by cutting down a bit, you know, because you're not going to notice it so much.
Yeah.